Hey everybody, welcome to Drug Talk. My name is Garrett Campbell and I'm going to be your host. My goal in making Drug Talk is really just to spread a little bit of
knowledge
about medications. I'll be honest, I always wanted to start a YouTube channel, but I could never really think of something that I felt comfortable with. A, I guess how much I really knew about the topic, and B, something I'd feel comfortable actually putting my face on YouTube with. Since I am a licensed pharmacist, I figured what better to talk about than drugs. So like I said, I am a licensed pharmacist. I'm currently working on the east coast of Canada in Nova Scotia. I'm currently living in the city of Halifax. And I've been licensed for about a couple of years now. Now before we get into the first episode, where we're going to talk about ibuprofen today, I just want to start by thanking you all for stopping by, and I really want to make this crystal clear here in the first episode. I'll probably end up repeating this every episode as we move forward, but I just want to make sure that everybody understands that this is only for information purposes only. Never base any of your personal healthcare decisions solely on watching this YouTube channel. So like I said, information purposes only, and always consult your personal healthcare provider when anytime you're making any personal healthcare decisions. Alright, so now that all that stuff's out of the way, let's get to the fun stuff and let's talk about drugs. So like I said, the first drug today is going to be ibuprofen. I figured I'd start off with something that everyone would have a little bit of knowledge about and maybe have taken at some point in their lives. If you haven't up until now, there's a pretty good chance you will at some point. And as we move forward in other episodes, we'll get into more complex, more interesting medications. So where did ibuprofen come from? I mean, it's been around for as long as I can remember, probably the same for most people out there. I personally feel like it's important to give credit to both the individual who created the medication as well as the company who gave this individual their opportunity to succeed. So to get the full story, we actually have to go all the way back to 1849. This is where John Boots actually created a herbal medicine shop in Nottingham. When John passed away in 1860, his son Jesse, at the age of 10, started helping out his mother at the shop. In 1883, they incorporated into Boots Co. Limited, and then into Boots Pure Drug Company Limited in 1888. The company was actually sold overseas, but then returned back into British hands in 1933, when it would be headed up by the grandson of the original owner, John Boot. Fast forward now to 1961, and it was in that year that Stuart Adams, who at the time was the head of the drug discovery department at Boots, discovered or filed a patent for ibuprofen. It was launched in the United Kingdom in 1969, and then later in the United States in 1974 as a treatment for rheumatoid arthritis. And then by 1984, it became, in both countries, the first non-steroidal anti-inflammatory drug, other than aspirin, to brand the label of over-the-counter. This was huge for Stuart Adams, who actually pushed him to receive the Order of the British Empire. And Boots did well for themselves, receiving the Queen's Award for Technical Achievement in 1987. If you were to look for this company now, that is Boots, you would actually find it as the Walgreens Boots Alliance, because in 2012, Walgreens actually purchased a 45% stake in Boots. In 2014, they would finalize the takeover, purchasing the remaining 55% of the company. Alright, so now that the boring stuff is taken care of, let's get into the real fun. Now, ibuprofen is considered a non-opioid NSAID, or non-steroidal anti-inflammatory drug. So as most people are aware, ibuprofen is typically used for pain and inflammation, oftentimes for both. It can also be used for migraines, menstrual cramps. It can be used as an antipyretic agent to reduce fever. An off-label use would be for acute or chronic pericarditis. So usually you can get ibuprofen as a 200 milligram or a 400 milligram strength tablet capsule, whatever you need. Recently, they've come out with a 600 milligram 12-hour ibuprofen. Now, the recommended dose is typically 2 to 400 milligrams taken 3 times a day. Many people do find relief with 200 milligrams. Great recommendation whenever you're purchasing it on your own or starting the medication for the first time is to start low and go slow. In terms of a maximum dose, over the counter, usually we recommend about 1200 milligrams daily, divided in 3 to 4 daily doses. When you prescribe the medication, it usually goes a little bit higher than that, and sometimes we see 2400. Again, keep in mind that this is the total daily dose. You wouldn't take this as one single dose. This would be divided up in 4 or 600 milligram chunks. If you're about to use this medication, just get in contact with your healthcare professional to find out what your max dose is, or just follow along with your label. So ibuprofen, as you're probably aware, comes in many different brand names. So you can see Advil, Motrin, we see Europrofen for kids, and it's also available as an IV injectable that you would usually only get in the hospital called Caldolor. And if you're personally not picky about which brand you use, most of the generic companies make a version of this as well. In terms of dosage forms, it comes in just about everything. Tablets, chewable and non-chewable, gel capsules. You can get it as a suspension. As I already mentioned, there's an IV injectable form. And you can get actually a cream that comes in a compoundable kit to a pharmacy, and they'll have the pharmacy staff prepare that for you. Earlier, we touched on the different uses of ibuprofen. Just to further put it into perspective for you, the common reasons I see ibuprofen usually used are for the management of pain associated with headache, menstrual cramps, physical overexertion, and I also see it a lot for dental procedures. Now, whenever somebody's going to use ibuprofen, there's a couple things that their prescriber will consider before they actually make the decision to give this medication to their patient. Oftentimes, usually more associated with other conditions that the patient may have or their age, they'll ensure that their kidney and liver function are appropriate. For your kidneys, we use a measurement called creatinine clearance. If this is below 30 mils per minute, you can't use ibuprofen. Now, in terms of your liver, if you have moderate impairment, you can still take the oral ibuprofen, but you wouldn't be able to use IV. If your liver gets severely impaired, you can't use ibuprofen at all. Now, age also plays a factor in whether or not you can use ibuprofen, because it does fall on what's called the Beers criteria. Now, luckily for you guys, I actually have the Beers criteria right here, so I'm going to read what they have to say about ibuprofen. Ibuprofen is identified in the Beers criteria as potentially inappropriate and to be avoided in patients 65 or older unless other agents are ineffective and the patient can concomitantly receive a gastroprotective agent. This is due to the increase in GI bleeding and peptic ulcer disease in older adults, especially in the high-risk category. As an example, this would be someone who is older than 75 years of age, receiving concomitant oral or parenteral corticosteroids or anticoagulants, antiplatelet agents. This may increase the risk of acute kidney injury and further decline kidney function in elderly patients with stages 4 or higher chronic kidney diseases or creatinine clearance less than 30 mils per min. So again, it is on the Beers criteria. So if you're in that higher age group, just make sure you just consult your healthcare professional whenever you're using any medications. Two more things that I think are worth reading before we get into the medication in terms of while you are taking it. Prior to taking it, it's important to know these two black box warnings that were put out in the United States. The first black box warning here is regarding cardiovascular events. NSAIDs cause an increased risk of serious and potentially fatal adverse cardiovascular thrombotic events, including fatal MI and stroke. Risk may occur early during treatment and may increase with duration of use. Secondly, the next black box warning is actually pertaining to gastrointestinal events. So, NSAIDs cause an increased risk in serious gastrointestinal inflammation, ulceration, bleeding, and perforation, may be fatal. Elderly patients and patients with a history of peptic ulcer disease and or GI bleeding are at a greater risk for serious GI events. These events may occur at any time during therapy and without warning. Now, of course, I'm not saying this to scare anybody. These are clearly warnings that would pertain to a certain subset of people that would be using these medications, and of course your healthcare professional would be well aware if you fit into these categories. So, you've made it through the prerequisites, and now you're ready to start taking ibuprofen. First thing that I'll say is that it's always very important to follow along with the instructions that were prescribed to you by your physician. Always do your best to take your medication as prescribed. If you haven't been prescribed ibuprofen and you've actually purchased it over the counter, you may want to take into consideration what you're using it for to dictate how you're going to dose yourself. If you're just using it for pain, follow the standard recommendation. You don't have to take it consistently, it's just whenever you feel like you need comfort. Alternatively, if you're treating pain as well as inflammation, or just inflammation, it's important to dose yourself consistently for a couple days. Now, there's two different resources that I've actually found that give a specific recommendation on how often to use it. One is RxFiles. RxFiles says that it takes about 1 to 2 weeks to reach the maximum anti-inflammatory effect of ibuprofen. Applied Therapeutics, another great reference, says that it takes about 5 to 7 days to reach that steady state concentration required for anti-inflammatory effect. Now, the minimum dose of ibuprofen that you can take to achieve anti-inflammatory effect would be 400 milligrams 3 times a day. So the rule of thumb, remember, with ibuprofen, if you're using it for pain, take it as you need it for your comfort levels. If you're using it for inflammation, take it consistently. So in terms of side effects, we're not going to dive too deep into them today on this episode, just because earlier we did talk about the black box warnings. So remember, those two would be gastrointestinal events, such as stomach ulcers or gastrointestinal bleeding, as well as cardiovascular risk. When people are going to be taking it for a short amount of time, mainly we just warn people about a little bit of stomach upset. We always recommend to have a meal before you take your dose if you find that troublesome. Now, if you think you require ibuprofen long term, you must meet with your physician, because in this class of NSAIDs, there's actually different medications, and some of them have better safety data to be used long term. Something that's common to see among long-term NSAID users is the addition of a gastroprotective agent, such as a proton pump inhibitor. Now, we're not going to discuss those in this episode, but look for future episodes where we'll discuss medications, most likely like Pantaloc. In terms of what you should do while you're taking the medication, just monitor yourself for those signs of stomach upset, for those signs of any stomach pain. It may be worth getting checked out if you notice anything. To end off the video, I guess I should do what all good pharmacists should do and remind you that it doesn't only come down to medications. There are other things you can do with regard to this topic to reduce your pain. But if you do feel like you need something to take the edge off, ibuprofen is definitely an appropriate option for most conditions. Again, I will remind you, consult your healthcare professional if you have any questions about your healthcare, and this channel is not to be used to make healthcare decisions, rather for a source of information. So everybody, thanks. I really appreciate you stopping by. Again, this is my first YouTube video. Don't have much experience with editing videos, so you may notice this one's a bit choppy, but I'm hoping as we move forward, we'll improve upon that. So if you have any suggestions or anything you'd like me to change up, really whatever, I have pretty thick skin, it's all good. Just you can mention it in the comments below. And I always wanted to say this, subscribe below. And if you'd like to find me anywhere else, you can find me on Twitter at TalkAboutDrugs. I'm on Instagram at GSauce24. And if you're interested in becoming friends on Facebook, you can just add me at Garrett Campbell. I haven't made a business account for any of this because, like I said, I'm just getting started and trying to figure out things as we go.